Hi, Dr. Petteruti. Welcome to the Genetic Genius. I'm so happy to have you as a guest today.
Well, thanks, Lulu. It's great to be here.
Yeah, well, before we jump into all this amazing things we're going to talk about today,
Yeah,
I just would love for you to introduce yourself. Tell us about your passion, what you're doing here on this planet to help people learn about health.
sure. I'd love to talk about that. I'm a board certified family doctor, Lulu, and I started my career at Tufts University, actually studying English literature. I
Mm,
always felt that the people were more interesting than the diseases they had. I knew I was going to go to medical school, and I didn't want to take the same courses twice. So I
right.
wanted to interweave that liberal arts element to it. I went to Philadelphia Osteopathic Medical School, and osteopathic physicians are known for a focus on the body's capacity for self-healing. And that really drew me in. I always knew I wanted to do primary care. Went
Mm-hmm.
from there to the Army, and I studied my residency in family medicine at Fort Benning. I had some wonderful mentors. And I was all in with conventional medicine, and I still admire and respect a lot of elements of it. I consider it an essential aspect of the healthcare spectrum. Well, Lulu, what I found out after practicing conventional family medicine is that pills were not making people healthy,
Mm,
that I was mitigating symptoms, that I had these little tiny chunks of time in order
mm-hmm.
to address a lifestyle conundrum. And I started to study obesity because I consider that to be the disease of our times. And medicine had nothing to offer, and a lot of dietary advice was misguided and fruitless.
Mm,
So I studied that. Dr. Blackburn out of Harvard did a series of courses in that field. And I discovered I wasn't alone. There were other clinicians interested in it very seriously. And I became board certified in that. I don't think that's a big deal, right? It's just your fund of knowledge and your ability to help people.
mm-hmm.
So I did. I changed the whole paradigm of treatment. We went outside of the insurance limitations. And we had great success. Then I
Mm-hmm.
turned my attention to anti-aging. When I turned 48 and I felt some effects of aging, that was, God, 14 years ago, I'll be 62. And when I turned 48, I realized, things were changing and I wasn't really fond of them. And
Mm,
I knew that anti-aging was real and it was a science. I also knew that there was a lot of smoke and mirrors. And I wanted to
mm-hmm.
separate the two. So I studied that. And after years of study, I began practicing it, weaving it into my practice. And now I have a concierge-based primary care here in Rhode Island. I call it anti-aging primary care, where we commingle the elements of anti-aging. What we're going to be focusing on today, I absolutely am over the moon passionate about. It is a missing piece. It's a blind spot. It's a contributor to heart disease, cancer, and dementia, chief among them. We're going to be talking about chelation. So I came to that knowledge through my patients once again, prompting me about their interest in receiving intravenous infusions. I said, great.
Mm.
Now I've got people wanting IV vitamins. Well, what did I open up here? What I opened up was a fabulous pathway of preventing disease. So in our system, we don't have a healthcare system. Listeners, pay attention to this. Most important thing you'll hear all day. We do not have a healthcare system. You do not have health insurance. We have a sick intervention system, and you have sick intervention insurance, in essence, prepaid sick care. There's not a
Mm-hmm.
hospital on the planet that makes money by treating healthy people. They make money by intervening in diseased states. And we need that. That's a history of medicine going back to Hippocrates, more or less.
Mm-hmm.
But today, your listeners have an ability to listen to us, go to the website, validate what we're talking about, and apply it.
Mm-hmm.
We're going to talk about chelation in a moment, but what got me there too was the vexing problem of sudden death. A large majority of people, a large plurality, I should say, of individuals with heart disease,
Mm-hmm.
their first symptom is sudden death. Well, I
Right.
don't treat sudden death, but there's a prelude to that spans decades.
Mm-hmm.
Likewise, dementia. Let's think about that for a moment. Why does a brain corrode? Here's a vexing thing. If your doctor ever says to you anything that is preceded by the phrase, for your age,
Right.
get another opinion.
Exactly.
For your age, your memory's not so bad. What
Mm-hmm.
is that?
Yeah, what does
There's a
that even
condition,
mean?
there's a label in medicine, I don't know if you're familiar with it, called MCI,
Mm-hmm.
mild cognitive impairment.
Mm-hmm.
Are you kidding me? Is that like being a little bit pregnant?
Right.
I don't like that term. It's a white flag. We
Mm-hmm.
do not have any means of intervening with dementia. There's not a medical treatment known to have an impact. And yet we know what poisons the brain.
Mm-hmm.
If you were living next door to a toxic waste site that had contaminated lead, they'd put yellow tape around it. They'd ask you to move away while they excavated it and got rid of the contaminant. We have it in our body, and this is something I've come to understand. And mainstream medicine does not really embrace this knowledge. They just don't, they haven't studied it, right? It's no knock on them. It's only so many hours in a day. There are only so many things you can do. So my mission is to educate people about what they can do to support their health way before the disease comes, way before the brain starts to slow down. And the patients will say, but I feel great. My brain's great. I feel great. All right, what comes next? Right? We all have to leave the planet at some point, but we do not need to become infirm prior to departure. We can have a vital youth up until death. Now I'm 62, as I said, about to be 62 in May, technically. I never felt better. Okay, my knees are a little bit rusty, but the rest of me, my brain feels great. My energy feels great. It's a beautiful way to live. So my patients all feel this. Infusion-based healthcare, to a large extent, I would say in combination with the type of work that you're doing, helping to educate people about what we eat, how we live, how we sleep, these things matter. And they matter in the short and the long term. This should become infusion-based support and chelation should become part of everybody's health routine and make it an element of daily living. We talked just before we came on air, right? About how we start our day. It's a routine.
Yeah, exactly.
My nutritious, I do a protein shake, head to the gym. Why? It's just my routine.
Yeah.
I advocate that everybody should be chelating on some level. The only question is with what frequency and what recipe. We can get into that as well. But those are the things that drive me. You know, I don't want anybody. So can I tell a quick story?
Of course, yes.
So here's your patient came to me. This is a sort of encapsulates, you know, why I come to work every day.
Yeah.
Woman is in her 80s when she came to see me. Her daughter brought her in. She'd broken her neck, had fallen. She was in a walker. She was gaining weight. She was losing energy, and she was concerned about her ability to maintain connectivity to her grandchildren, one of her ambitions. So we brought her into the practice. We started to treat the weight. We started to treat hormonal support. We gave her infusion-based healthcare. Can I tell you, 6 months later, she had lost 30 pounds of fat, gotten rid of her walker, and felt like $1 million.
Wow, it's amazing.
In her 80s.
Yeah.
So my point is that it's never too late on the one hand.
Right. No.
And on the other hand, let's not have a self-fulfilling prophecy. Traditional approaches to managing aging is to make sure your walker fits properly. We want to get rid of it. Get rid of the walker.
Yeah.
Traditional approach to managing heart disease is to wait until you get a heart attack and put in stents. Some of the wave. That is what we do every day here. And we really want to reach out to younger people because, boy, that's where you can really have a lifetime impact.
Right. Oh, I love that, Dr. Steve. You know, everything you said is exactly kind of like, you know, my philosophy and my standpoint too in life and how I help patients. And I really just loved what you said about, you know, we have a whole new change in the way that we're visualizing healthcare because it is a preventative medicine. It's preventative health, and we can make the change. It's just like helping and educating people about how to do it because it's been lost along the way. You know, it's become very lost in the pill medicine, pill giving medicine, which, you know, is needed. There's a total need for that in some situations, but there's also a whole different aspect of health that we can help with. And I love that about everything that you said.
Thank you. You know, I think the infusion approach, and by the way, listeners, for infusion, what I'm talking about is an IV placed in the vein for the purpose of directly infusing, not drugs, but vitamins and micronutrients. So there is the first question. Why would a totally healthy person put a needle in their arm and be infused with vitamins?
Yeah.
Why not just take them orally?
Right. Exactly. Yeah. And we're going to dive deep into like all about that and reasons about why you would want to do chelation. So let's start there. So first of all, like what is chelation IV therapy? Because I think that's, you know, it's a term a lot of people don't even know what that means.
Right. Chelation refers to pulling out items from the body. Chelate means to adhere to like from a claw, from a crab. So calcium EDTA is a product that we use at Drip Bar, the infusion centers that we're opening. And the chelating element, calcium EDTA, has been around for decades. It's FDA approved for removing toxic lead. It chelates or hooks onto the heavy metals Now, these heavy metals, Lulu, they don't float around in the blood. You can't determine how much is there by virtue of a blood test.
Right.
They move through the blood, they go into the bone and tissue. So the chelation process pulls them out and then filters them through the kidney. Basically, you pee them out.
Yeah, exactly.
It's a great thing. So this has been around for decades, and doctors like me have been infusing patients with mixes, including calcium EDTA, and the chelation therapy includes not only calcium EDTA, but high dose vitamin C, mixed B vitamins, magnesium. So there are other nutritive elements in there that exceed what you can absorb orally. For instance, the vitamin C is 7,000 milligrams, in that neighborhood, far more than what you can get taken orally. Vitamin C is a chelator unto itself. It actually does help pull out metals. Very importantly, vitamin C can cross the blood-brain barrier, which other products cannot. It also supports collagen, soft tissue, and elasticity. So you hold on to that thought, and we'll talk about the proof of chelation. So here's chelation. It's being used in niches throughout the country and the world. And patients are getting better. Their heart disease, their chest pain's going away. Their peripheral vascular disease is getting better. And conventional medicine is looking at this sideways and saying, this looks like snake oil. It looks like quackery. And you know what, in medicine, if you have a great outcome with a drug treatment, you call it a case study. Right. If you want to denigrate it, you call it a one-off, you call it idiosyncratic, right? It's not really legitimate. So terminology here is relevant. Right. So we have case studies, not anecdotes, case studies of individuals gaining benefit. So the question came up, and I have to give a lot of credit to Dr. Gervasio Lamas. He's a cardiologist out of University of Miami, affiliated with Columbia Hospital. I had the pleasure to speak to him a couple of years ago, and he was the designer of the TACT trial to assess chelation therapy. So conventional medicine got fed up with quacks like me giving snake oil. They said, we're going to put this to the test. We are going to design a debunking study to show it doesn't work, so people can get off this wagon. Yeah. Well, Dr. Lamas helped design it. In 2002, he's sitting in his office. A patient came to him and said, Dr. Lamas, I'm going to do chelation therapy for my heart disease. And without thinking, he said, that is a waste of your money. That's quackery. But to his credit, he told me, he went home that night, gave it some thought, and he realized he had no basis for what he had just said. He had no research-based evidence. It was simply the prevailing dogma. So he went to the research, and lo and behold, he found proof of benefit, suggestive proof. So the TACT trial is a $31 million, multi-centered, double-blind, placebo-controlled, NIH-sponsored study. In other words, ladies and gentlemen, it is the summit, the gold standard of studies.
Yeah, that's a huge study.
Colossal study, and nobody's ever heard about it, which is horrible. But by golly, your listeners have. Thank you. For them. So this trial is taking place, and the objective is to see, will this help heart disease? Will it help angina? Will it reverse chest pain? And they took folks who'd had heart attacks, and they subjected them to weekly infusions of intravenous chelation. Now, in the study, Lulu, they used a product called disodium EDTA. The disodium has just been around for a long time. It takes 3 hours to infuse. At Drip Bar, we use calcium EDTA because it's safer and faster. Yeah. And equally efficacious. Anyhow, at the end of the study, lo and behold, they found profound decreases in heart attack, stenting, hospitalizations, all-cause mortality, with no increased side effect compared to placebo. It was through the roof. Yeah, that's amazing. That already were on statin drugs, blood pressure drugs. This benefit was above and beyond all of that. We did a subset looking at diabetics. The reduction in heart attack and consequences in diabetics exceeded 40% across the board. Wow. That is front page news. Stop the press. Instantly, people should be getting infused. Yeah. Why did it not happen? Well, why didn't it happen? It ran up against the convention of medicine, whereby this treatment, it's not FDA approved. Oh, right. Not a patentable drug. It's a bag full of vitamins. Weird in its delivery. And you have guys like me doing it. I'm just a humble family doc in the hinterland of Rhode Island. This is an absolute grassroots movement.
Yeah.
Now,
Mm-hmm.
they are doing a second trial called TACT-2,
Mm-hmm.
help validate the findings of the first trial. Lulu, these trials take sometimes 10 years or more.
Yeah, they do. They do a lot of research.
If this were a drug, to put it in perspective, they would have broken the code. That means they would have shortened the study and rushed the drug to market. Now we're
Exactly.
seeing warp speed, get the immunization out there. It's
Mm-hmm.
important. What about these people suffering with heart disease? Why not start this chelation process like right now?
Yeah.
Very exciting information, brand new research emanating from intellectual medicine, delivered to the drip bar that I'm going to share with your listeners. I'm going to wait for you to cue me on that.
Yay.
But it fell a little bit on deaf ears, the community at large. Now, there are some places, and Dr. Lamas down there in Miami is offering some chelation. But here's the state of chelation today. It's non-insurance reimbursed.
Right.
It's direct to the consumer.
And it's expensive.
Practically speaking,
Mm-hmm.
people can't necessarily afford every week to go get a chelation. It can cost $190, $200 in that neighborhood.
Yeah.
So my challenge was to extrapolate all that data, all that science, and make it practical. Then make it available. So
right.
Our goal is to have an infusion center, we call them drip bars, available within driving distance of everybody in America.
Yeah.
We're on our way toward that objective because we feel that people who chelate on a regular basis are going to have a lower incidence of heart disease, dementia, and cancer. And what I just said is not FDA approved. It's not been proven. There may never be a capacity to actually prove it beyond doubt. And we've already seen the double-blind placebo study kind of falling on deaf ears, so to speak.
Right.
This is experiential. That is, we have to use the science, communicate honestly with the people out there, and let them make choices. It's like that toxic waste dump. There's no proof that if you clean up that toxic site, people are going to live better longer. But we do know lead, cadmium is another toxic heavy metal, are pure toxins. They have no business being in your body. So chelating them intravenously is a powerful means of eliminating them, extraordinarily safe. And we have now developed practical approaches that are available to just about anybody who would choose to do it.
Oh, that's great. And, I love that vision of really having, the availability, not only for alternative health, but for chelation and IV therapy. We have in Asheville, we have a hydration bar, Hydrate Asheville. And it's great because I refer patients, because I don't do IV therapy myself, but I refer patients there, and it's great because I know the value of it. And I'm so happy that that's part of your vision, because I think it's so key for health. And so let's talk about, say someone is thinking they have some heavy metal toxicity, but they're not sure. Is there some type of testing that you recommend to preface that chelation therapy?
Absolutely. First, we all have heavy metals, 100%.
That's right.
You're born with it. Your mother gave it to you in utero. She had heavy metal. It went through her umbilical cord into your bloodstream and then into your bones. So you were born with it. And there's studies showing that. In fact, in Drip Bar, we'll soon be releasing a prenatal infusion series of chelation.
Nice. That's
it's
great.
designed for women that are contemplating pregnancy. You should not chelate while pregnant because we're uncertain of its impact. However, lower those toxic metals before you get pregnant. We know lead is extraordinarily toxic to children. In adults, we perceive ourselves being more resilient, but there are studies correlating the total body lead with cognitive decline. Simply put, more lead, less brain power over time, a drop in IQ. Now, if adults are affected and if children are profoundly affected, can we imagine what a developing brain, how vulnerable it is? And even relatively modest reductions of lead, you can't completely eliminate it, right?
Right.
We've been smelting lead for 5,000 years. It's a potato that covers the planet.
Yeah.
They've done archaeologic studies looking at prehistoric bone and estimated that our lead level is about 1,000 times above norm, Western man. Our lead level today is equivalent to that of ancient Romans, and they're notorious for having lead.
Yeah.
So here's Here's an existential question, Lulu. If everybody in the country is poisoned at the same level with the same toxin and nobody knows it, it would seem to be normal. It would seem to be normal. Normal that, right? People get high blood pressure. This has happened throughout the world. So you asked a question about how to test lead. You can't test it in the blood. It will give you a reflection of what you've been exposed to in the previous week or two.
Right.
If your blood test is negative, and first, negative is a relative term. Some labs will only test below 5. Really, it can't get a great test, but if it's low, you're not off the hook.
Right.
You can test in hair, which will give you a reflection for several months, so long as the hair grows.
Right.
You have to accumulate enough volume for that. I may be hair challenged in that regard.
Yeah.
But the gold standard at Drip Bar and at Intellectual Medicine is a provocative intravenous challenge. They get an intravenous infusion of calcium ADTA along with glutathione. Now that's a bit unique. We combine these two. Number one, glutathione enhances extraction of lead and cadmium. Cadmium is a class 1 carcinogen and it's correlated with breast cancer. So it pulls both out. It also is renal protective and a great antioxidant as urine.
Right. Yeah.
We combine those two, and then the individual will collect a urine over the next 6 hours and send a specimen of that to the lab for analysis. And that'll give us an estimate of the total body load of lead that they're carrying around.
Right. Oh, that's great. Yeah, that's a wonderful test because I know that, the hair analysis, it gives us it gives us a snapshot, but it doesn't give us the whole picture. And I'd use that with patients, but I'm like, this is giving us this image, but let's make sure we're really diving deep into some of the root causes. And like you said, those heavy metals have been for generations. We have had family members that have been in mines and all kinds of things that have been carried down through our DNA and through our blood and through our bones. And like you said, through the mother. And I know there's lots of studies that are now being done on the toxins in the umbilical cord, which is this massive amount, which is so changing for our children growing up today. And so I love that you said having that prenatal chelation and detoxification. And I think more awareness is happening but not everybody is planning their pregnancy, but for those that are and having problems with infertility, which is also a huge problem we're facing right now too. They're seeing like, okay, what can we do to help prevent these toxins that are in our system to carry on through further generations?
That's a great point. I mean, they're impossible to fully avoid.
Right.
Mitigate exposure.
Can't live in a bubble.
You can eat organic food, but they're not testing that food for lead or cadmium.
No.
So you can be mitigation, but I maintain everybody needs or should consider some form of chelation. So you start out with the baseline heavy metal testing. You take a look at where you are. Now, remember, lead contributes to high blood pressure, heart disease, coronary artery disease, may contribute to cancer, and clearly is cognitively impairing. Well, there are a lot of things you do every day for your clients that help protect against all those attributes, right? Obesity correlates with all the above, including dementia.
Right.
Radical toxicity, or I should say harm to the brain and the arteries, is a real issue. And that free radical formation correlates to the foods we eat and the way we eat them. I mean, we can go on a whole spectrum of that, and I know you've done that already. But bringing it back into the intravenous world, we've developed different approaches to chelation so that we can test. Now I'm asking your listeners, people throughout America, to contemplate the space between. We are defining a new space along with you, along with others. Typically, they are, let's call them renegade doctors like me, or they're non-traditional doctors.
Right, and like me.
That's right. And again, we love and honor our mainstream clinicians.
Right, exactly. Everybody has a place.
If I have a tumor that needs to be cut out, if I have a bone that's broken, that's where I'm heading.
Yeah.
But let's back it up a few decades. Health is our responsibility. It's our prerogative. How we define health is our choice.
Exactly.
And if we define health by the absence of toxicity, by the presence of vitality, then here's the thing I'll say to listeners, right? What is your monthly budget for anti-aging health support? What's your monthly budget?
Right.
And we don't have dollar amounts. When I was a kid, you don't remember this, television was nothing. It was free. right? You had a box, you turn it
Right.
on.
You just turn it on and way to go.
My monthly budget for watching television was zero.
Right.
Now it's $300-400 a month.
Right.
And I can't even operate the damn thing. The point is that a new technology appeared that created a decision point for every person. Right? Incorporate it, and how much is it worth? Health-based, cellular-based healthcare. We call this cell V healthcare. It was Dr. Virchow in the 1800s who theorized, quite accurately, I believe, and I think you'll agree, all disease starts at a cellular level.
That's right.
So too all health. A bad cell recreates itself, whether it's a cancer cell,
Exactly.
or it's an endothelial cell lining the artery. That damage is happening chronically, silently for years, decades, and then poof, here's a tumor, poof, here's dementia. It's not a sudden thing.
It's not like overnight, like, yeah, I immediately had this massive tumor.
So let's get to that cellular level of that. So we test that, and we test the two heavy metals that I am most focused on, lead and cadmium. We find it typically high levels. Now, here's where patients will say, but what should it be?
Right. What's the level you're aiming towards?
The honest answer is we don't know where the threshold is.
Oh,
we
yeah.
don't know how low we need to go to give you protection.
Right.
But we do know this is a pure toxin. There are studies out there correlating dose with outcome. I mean, it's logical, right? More toxin, more bad outcome. So our goal is to mitigate and reduce that, not completely eliminate. So here was a question. We answered it with a research study done here, published in a peer-reviewed medical journal by me recently. And the question was this: I feel great. I just got my lead tested. I'm doing these infusions. We advocate for them once a month. In some cases, once every 3 months. So here you are. You're about, what, 20, young, very young woman, healthy, right? Don't smoke. I'm healthy. I'm young. I feel vital. What should I do? Well, in some cases, an infusion as infrequently as every 3 months can have a powerful effect on accumulated lead. So in the study that I published, it was in the journal Curious, Cureus. It can be found on my website, and on the, if you go to PubMed, it will appear. If you look at Dr. Petteruti, it'll pop up there. Anyhow, we looked at individuals who had chelation done on an average of once every month or two, for an average of approximately 11 infusions, that spanned upwards of 16 months. We did a before and an after study. And I wanted to know, if I do it that infrequently,
once a month,
you know, every patient in this cohort, there were about 16, as I recall, every one of them had reduction in lead, 100%.
Wow, that's great.
Now, we don't get 100% reduction universally. There are occasions where the lead doesn't go down, and then we have to look at why not, you know, is it still being inputted? But in this study, we had that kind of an outcome, an average reduction of 39%. That's a pretty relevant number. When you take where you started, you drop it 39%. Furthermore, we haven't published this paper yet, but we saw a reduction in cadmium in all but 2 of these patients. So here we've got a treatment approach that has evidence of benefit with reduction of lead, with an infrequent infusion, with no side effects that have been significantly, no significant side effects, and at a level that's affordable. So you can choose to incorporate that into your healthy lifestyle. Where does it fit? You know, in my view, it fits. Look, if you're an overweight smoker who isn't exercising, your first dollar is spent on those basic elements. But we believe at Intellectual Medicine that this is more powerful than exercise for the purpose of preserving heart, arteries, and brain. I love exercise. I do it every day. However, there's a difference between fitness and health, and cellular health.
Exactly.
Just for your listeners' benefit. Again, I love exercise, but there's this concept of fit equals healthy that can mislead people.
Yeah, that's true.
I had a gentleman come into my practice, and he's in his 70s, and he had washboard abs, and he has biceps, and he has a young girlfriend, and he drives a sports car, and he goes, I am just, you know, king of the road. His lead level was super high. I then did a study called the calcium score. Are you familiar with calcium scores? So for your listeners' benefit, it's a CAT scan of the heart. That can look at the coronary arteries. Those are the arteries that feed blood to your heart. And we can tell if there's calcium buildup on those arteries or not.
Right. Super important for blood to the brain.
Yeah, right. So that's a great point by you. And that is, if we see arterial disease anywhere in the body, it's everywhere.
Exactly.
The idea that, hey, I had a stent put in, now I'm good.
Like, no, that's not mean you're good.
Doesn't mean you're good. So the chelation therapy, so here's the question then, all right? We know we can lower lead. Lead is toxic to the brain. The TAC trial proved that it can have an improvement with heart disease. The question then became, well, why? What's going on?
Yeah, what's going on? What's the root cause of why this toxicity is happening in the system? That's my next, you made the segue for the next questions.
So we talked a moment ago about reactive oxygen species or free radicals.
Yep.
These free radicals, people, are essential. Without them, you would die.
Right.
When you're infected, they kill things. When you eat food, they digest the food. So free radicals need to be proportional.
Right. You don't want to have too many, too less.
In America, they generally are way too high.
Right. Yes.
Recklessly.
We're reacting to too many things.
Oh, it's terrible. So, okay, we want the free radicals mitigated. That's important.
Yeah, number one.
Then the theory was, well, maybe what chelation is doing is helping capillaries. These are the microscopic blood vessels that are the end of the road of your circulatory system, where they deliver nutrients and oxygen to the cells.
Right.
When you do a CAT scan of the brain of an individual, sometimes it'll come back with a report, microvascular damage, meaning there's dead parts of the brain due to capillaries choked off.
That is bad news.
Scary, right?
Super scary.
Scary, and it never needs to happen.
Yeah.
Dead capillaries equal dead cells.
Yeah.
If you've had a stent put in, you have microvascular damage. There's a direct correlation.
Yeah, exactly.
Heart disease and dementia.
Yeah, your cells of the heart begin to deteriorate and die. We do testing for that too, and so when that's signaling us, so let's talk about that. So when we have that signal, whether that's from a cardiovascular event, right? But then let's say you're feeling, well, let's back up a little bit. What would be some of the signs and symptoms? What would somebody be feeling? I know we talked about, someone feeling healthy and we still have that toxicity in the blood, but what would somebody be experiencing? Like, I'm having this. Maybe I need to see if I have some heavy metals in the system.
Okay. So your point about being healthy is well taken. We're healthy. It's a momentary spot in time. So please, healthy people, get your lead tested and chelate, even though you feel great.
Yep.
Let's flip to the symptomatic people. Anybody with heart disease, 100% should be chelating, in my opinion. The studies validate that. And we'll talk about the calcium score study that we're about to publish out of intellectual medicine. The first time in the history of medicine that I'm aware of where we've actually been able to reverse calcium buildup.
That's great.
With that as a teaser, back to the symptoms. Lead is a contributor to neuropathies.
Yep.
So think burning, neuropathies in the fingers and the feet. Think about folks with fibromyalgia. It's a muscle nerve interface dysfunction.
Yep.
We're not sure what causes it, but lead can be a contributor. Parkinson's disease is another disease of, I would say, pretty much any neurodegenerative disease. The nerves are exquisitely sensitive to the toxin of lead. They can take decades to manifest that sensitivity. So we advocate for chelation in conjunction with high-dose glutathione. Another thing I'm seeing a lot of, Lulu, is a hormonal dysfunction. These toxins, these toxic metals, appear to be interfering with pituitary gonadal function.
Yeah, makes
fertility.
sense.
We're seeing dysfunctional uterine bleeding. We're seeing women with infertility. We're seeing men in their 30s with libido dysfunction, erectile difficulty.
That's not should be happening.
These horribly low testosterone levels. Like, what's going on?
Yeah.
So to a person, we check them for their lead. If you're taking Viagra to help your erections, you should get your lead checked. That's
exactly.
Issue.
Yeah, totally a vascular issue.
and then autoimmune processes. An incredible amount of that going on.
Right.
Hashimoto's thyroiditis, diabetes itself is an autoimmune process. The whole gut milieu. Here's what's really horrible about drug therapy. So heavy metals can, in my opinion, based on my experience and research, contribute to, if not cause, autoimmune processes.
Yep.
when you have your gut in a dysfunctional state. Now, how do you know that? People, if you're taking Prilosec, you've got a dysfunctional gut. But here's a question I'll ask my patient.
Totally. Any PPI that you're on definitely means you have a problem with your gut.
Thank you. I'll say, how's your stomach working? Oh, it's fine.
It's fine. No
You have heartburn?
problems.
No, I don't. I take Prilosec every day and the gut's fine.
Right.
No.
No, that's downstream, really bad side effects. Not good for you.
Yeah, so we're interfering with micronutrient absorption, as you all know.
Yeah.
Proton puppet. Look, when I grew up in medicine, nobody took Prilosec. It didn't exist.
Right.
In a weird way, the drug has enabled people to eat even worse.
Right. It's like a crappy food enabler. Like, oh, I'll just take my Prilosec. I just had this really bad meal. Like, that's not the standard American diet solution.
Maybe some of these foods should come with Prilosec attached right to it.
Right. It just comes with a little like attachment on the box.
That's right.
Yeah, no, not good.
Another question I love to ask you, talk about detoxing, right?
Mhm.
We all know that you got to have a bowel movement to detox. You got to poop.
Right. Yeah.
So another question I'll ask people is, do you have constipation? No, I don't.
No, I go like once a week.
Thank you. Right.
Right, yeah.
I take Metamucil every day and
Right.
cathartics. No.
No.
So these are signs of dysfunction. We see neuropathy. We can
Yeah.
see fibromyalgia, any kind of neurocognitive impairment,
Mhm.
hormonal impairment. These are conditions where we'll look to the heavy metals. Clients and patients need to bear in mind that at that point, they're dealing with a multifaceted phenomena. They don't come to you, Lulu, like the first month they felt bad, right? They go to the doctor.
They're like way down the line.
They've had CAT scans, MRIs, they've had nerve conduction studies, and they've run and maybe it's 2 years into it, and here they present. Be patient, people.
Right.
Nerves heal slowly.
Right.
We measure recovery in months,
Mhm.
weeks.
Yeah.
So if they're
so true.
symptomatic, they need to be mindful of the arc that can span greater than a year.
Yeah.
They're consistent. And that's why my patients, your patients, they need to construct this like long-term for them. It's a lifestyle choice.
Yeah, that's so true. And so why do you think that this level of toxicity in the bodies and the body and the cells is increasing? Like, why are we on this, I don't know, almost like a trajectory, and we've seen it increasing over time? And you mentioned that a little bit, but do you think it's because from the increase of pollutants? You think it's our bodies are more toxic? We're having, increase of things we're ingesting and not allowing for things to eliminate properly, or all those together?
Yeah, it's kind of all the above, Look, a pandemic that is unrecognized will never be remedied. To the extent that lead is a universal toxin, to the extent that we all have levels in our body, in our bones, cadmium as well. Why, when a woman from Southeast Asia moves from their homeland to America, why does their breast cancer rate skyrocket? Why in America do we have a ridiculous rate of hypertension?
Right.
And
Yeah.
in less developed nations, it's nearly non-existent.
Right. Yeah. What is that?
We're not talking about a genetic inevitability. It's an epigenetic phenomenon. It's the individual meeting the environment.
Right.
So we've constructed an environment that is very technically dependent. We've eliminated walking as a means of locomotion.
Right.
We've eliminated whole foods as a means of sustenance. We have ignored the accumulation of lead. Now, the good news, lead's no longer in paint. And it's no longer in most gasolines. So
Right. At least we eliminated that. That's good.
So that is good.
Right.
But this is the reason why we need to take charge of our health.
Mm-hmm.
We can't wait for the government, for society at large to fix it.
Right.
The
Not
buzz
gonna
right now
happen.
is on global warming. Okay, it's nice to talk about. It may have value. I'm not an expert in that field.
Mm-hmm.
However, to me, this lead supersedes it because it's real, it's present, and the best we could do is try to mitigate it by doing the chelation. So you've got all these factors. Obesity makes everything worse.
Right.
So if you've got a background of lead, and then you add to it the free radical storm of our standard eating patterns, and you overlayer it with this obesity phenomenon, which is also a free radical, you get to a tipping point.
Right. It's not a good scenario because those fats are going to hold on to the toxins, and the more fat cells you have, the harder or more difficult it is to let those toxins out of the system.
Correct.
Yeah.
So I think, you do it all. You do it all to the extent that your time and your budget allow. We've talked
Right.
about chelation being a monthly thing every 3 months. I tell my clients we don't want it to be a stress point, but rather something that flows in your life.
Yeah.
So here's the exciting study. Can I tell you about my calcium score study?
Oh yeah.
Is this time
Let's
for
go.
that?
Oh, totally.
So calcium scores, if you'll do the literature searches, are felt to be irreversible. When you have calcium buildup in your arteries, and by the way, folks, if you're age 50 or older, don't get this study done when you're young. In my opinion, and based upon the pathology, it takes decades for calcium to form.
Right, to build up in the arteries.
Get a calcium score when you're 30, it comes back 0. It's more likely to be misleading than meaningful.
Yeah.
Because you can have soft plaque buildup, hasn't had time to calcify yet. So start with the basics nutritionally, with the heavy metal testing. When you hit 50, in my opinion, universally people should get calcium scores.
Just so you have a baseline.
Have a baseline. I used to think that women could do it later, and there was a study published showed women in the late 30s to the early 60s, totally healthy, non-smokers, normal cholesterol, fit, lean. 35% of them had positive calcium scores.
Wow, that's a huge number.
It's huge, particularly when these people think they're healthy.
Right. They're not going to be doing something to shift if they're thinking they're healthy.
Right. So we always hear about these folks. They're in the prime of their life, in their 50s, in their 60s, in peak of health, exercising, Xboxing, whatever they're doing, PX50ing, they're lean, and bang, they drop dead.
Right.
False comfort by virtue of rock abs, get a calcium score.
Rock ab comfort.
Rock abs do not equal clear arteries.
Right. No.
So here's your calcium score at age 50. You'll have to pay for this. Insurance does not cover it.
Right.
In our neighborhood, it's about $100.
Yeah.
Big money. Now, the tradition was, or the understanding was, you couldn't reverse it. A study was done looking at high-dose Lipitor, torvastatin. It's a statin drug that lowers cholesterol, and people that had a positive calcium score. Now, normally, there should be no calcium in your arteries at all.
Right. Zero.
Zero. If I see any, I think it's relevant. Right?
Exactly.
Is that important? Well, think of it this way. It's like frost on the lawn in October. We know what's coming next.
Right. Yeah, exactly. It's a warning sign.
Yeah, absolutely. So it is the most powerful risk factor that we know of, more powerful than blood pressure, blood sugar, body weight, diabetes. It trumps them all. So a zero calcium score is powerfully negative predicting. If it's present, they did the study for 4 years, people on high dose Lipitor versus placebo. They found both groups had an increase in calcium score at the same rate. That was disturbing because why would Lipitor not reverse? Well, it turns out that the statin drugs seem to have an effect on that soft plaque we're talking about, the lining of the artery. They have anti-inflammatory attributes. If you've had a heart attack or you're diabetic, statistically speaking, there's merit in considering taking them. However, for the rest of us, I advocate chelation over statin.
Oh, totally.
You're completely healthy, and you're going to take a drug for the rest of your life?
No.
To me.
No, then it changes the function of your liver too. Your liver's not doing its job anymore. You're telling it to stop what it's doing.
Without going too far on a segue, you need cholesterol, people.
Right. Yeah. It's a good thing.
Hormones. It makes neurotransmitters.
It makes everything almost.
Right. So cholesterol is not intrinsically bad. God didn't put it there just to piss you off. It's got its merit. So back to this calcium score. In the early studies on chelation, they did not see improvement. None of this made sense to me. And I felt my theory was they just didn't do it long enough. That which takes decades to occur may take years to
remove.
I had my first client. He was chelating, again, washboard abs, fit, non-smoker in his 70s, calcium score of like 1700. So a year later, we were chelating him. His calcium score actually went up. Well, okay. The theory is initially that can happen because calcium is the body's way of protecting the artery.
Right.
So, but we persevered. He's a PhD. He's a really bright guy. He's on board with me. He goes, let's keep going.
Right.
A couple of years later, after went up, it dropped precipitously. Exciting to me.
Yeah.
So we did the same thing. We have now 16 patients that we've been following. 15 of the 16, Lulu, have had reversal of calcium scores.
Wow, that's great.
After 2 to 3 years of this monthly chelation.
That's amazing.
Great.
Yeah, that's great.
Because, now we marry that up with Dr. Gervasio Lamas's work on the TAC trial. Now we have anatomical evidence of reversing hardening of the arteries. That's
Yeah,
breathtaking. That's never
totally.
been demonstrated. So it's incumbent upon me to publish this study. I just
Yeah.
shared with you pre-publication information
That's
that
great.
it needs to get out into the domain of peer review so other doctors can tear it apart and scrutinize it and hopefully mimic it and gather more data. The next thing we're going to go after is brain. And at another time you invite me back, we'll talk about brains. And
I would love that. Yeah, I love talking about brain health, one of my favorite categories. One question I was going to ask you too, what do you think about the difference between doing a thermography of the carotids as opposed to doing a CAT scan?
I am not aware of a correlation between thermography and disease outcomes.
Okay.
So there's a fund of knowledge I'm not fully well read in.
Yeah.
I do know that the CAT scan does have a radiation exposure. So the
Right.
consideration is very reasonable. I am very judicious in the use of X-rays, CAT scans. I believe they're overutilized. I believe they are contributing to the background noise of cancer. I know they're ignored. No
Right.
doctor ever said, what is your lifetime accumulation of millisieverts of radiation prior to ordering yet another?
Right. Another scan.
Like in my career, regarding thermography, I would advocate for the calcium score.
Yeah.
The literature around calcium score is really robust. It's deep, it's broad. And Lulu, if you have literature on thermography, please forward it to me. I'd be glad to look at it with you.
Yeah, I've been looking for more research on it. So I've been diving into it because I have some patients that have been asking me about those specific correlations or differences because, it is something to think about if you've had a lot of thermography or radiation or x-rays, whatever you've had in the past, but having that accumulation over time is something to be aware of, especially if you're older and you're working on getting those out of the system.
Right. So with regard to calcium score, the good news is that it's a 5-minute study, low dose radiation, and it's not sequentially monitored.
Right.
Now that we know it takes 3 years to reverse that calcium score, you can certainly delay a repeat study. In some cases, patients will choose never to get a repeat study.
Yeah.
Since
Great.
they know they're going to make this part of their lifestyle.
Right. Yeah. They feel that change within themselves. So let's talk about the infusion therapy. We mentioned it a little bit. So how does this kind of differ from chelation therapy for our listeners?
Well, there's chelation is one of the various types of intravenous infusions. These infusion centers sort of got their reputation as being hangover bars in
Right.
Vegas, right?
Yeah, right.
Where you imbibe too much and it'll help you. Okay.
Yeah.
If you come to a drip bar, we're not going to turn you away. We'll help you.
Right.
But our focus is not on salvaging hangovers.
Right. The partying.
Right. It's in some ways it's in contradistinction to what we advocate, which is a healthy lifestyle. A healthy lifestyle, folks, it doesn't mean not partying. It means healthy partying.
Healthy partying, right? Yes, enjoying life in a healthy way.
So we have taken the cellular-based health approach, and we've targeted a whole array of different conditions. I have a book soon to be published. The working title it's called Drip for Life. That's our working title.
Oh, nice. That's great. I love that.
Thanks. I just finished it. I'm proofing it as we speak. It'll be up within the year. And it describes the science behind intravenous infusion, why you should do it, who should do it. So there certainly is chelation. I think that's a universal.
Right.
Then you've got anybody with any gut issue. If you're on a proton pump inhibitor, you should be infusing to make sure your micronutrients are sufficient. You and I are both aware of the RDA,
right?
Recommended daily. Okay, if you don't want to catch scurvy, the RDA will help you. But we're
not real pirates anymore.
Right,
scurvy.
What we don't know, Lulu, is what's the MBA, maximum beneficial amount.
Yeah, that hasn't been studied. There's not a percentage for that.
No, and it's different for everybody, right?
If you're a
triathlete, if you're somebody that smokes cigarettes. So anyhow, if you've got gut issues, we advocate for it.
Right, you're not absorbing.
So there's an array: headaches, fibromyalgia, chronic fatigue. These are the conditions where the infusion-based health support has enormous merit. We have a whole approach to cancer support. There's a whole separate focus that you and I should engage your listeners with regard to cancer. The misdirected perception of cancer as being an early stage diagnosis when you see a tumor. Folks, we need to get to the cellular level.
Right.
The background noise, they did, again, archaeologic studies. This fascinates me. Like, what is the real disease rate?
Yeah.
Some have theorized cancer should be 1% of the population, no more.
Right.
And that everything else is a toxic exposure. You know, when I started my career, Lulu, if a patient had a glioblastoma, which is a form of malignant brain tumor, we'd go to the ward to see them, to do the exam. I said, wow, not that we were like intrigued and not caring about their suffering, but rather it was a rare disease.
Super rare, right?
Right?
Yeah.
Oh, a month can't go by now without me hearing of or diagnosing or seeing it. I believe that it's a combination of variables, one of which we talked about, radiation exposure, folks.
Yeah.
X-rays are carcinogens.
Right, exactly.
Go to an emergency room, you can't bonk your head without getting a CAT scan of.
Right, that's when you need it.
You don't need a CAT scan of the brain. You do not need a CAT scan of the brain because you bonked your head, right? You need it if you have compelling symptoms.
Oh, right, yes.
The medical legal environment we're in that drives doctors to do these studies with enormously low yield. My wife and I were out go-kart racing. A car smashed into her. She injured her shoulder and her chest. Emergency room visit, X-ray negative. They came back and said, we're going to do a CAT scan of the lungs. And so she's a nurse practitioner. I'm a doc. We said, well, what are you looking for? Well, in case she has a collapsed lung. I said, okay.
Yeah.
She feels fine. She's breathing fine. The likelihood of a collapsed lung approach is like
very little if you're still breathing fine.
So we said, look, we'll call you if things go badly. And the doctor was pretty cool. He said, yeah, I get that. That's fine. He canceled the CAT scan.
Yeah.
My point is that had we not had the knowledge we did, and had we not queried the rationale for the CAT scan,
exactly,
would have gotten a CAT scan.
Right.
So a chest CAT scan is about 10 to 20,000 millisieverts of radiation, or microsieverts radiation, compared to a mammogram is about 400.
Right.
So it gives you a perspective. So anyhow, that's part of our mission, yours and mine, is to educate people, make them question decisions regarding their health, not maliciously, but for the sake of their own, I call it medical assertiveness.
Right, to be empowered to make your own decisions, because that power has been taken away because of which is really unfortunate.
It is, and it's disparaging to patients. You know, once upon a time, we had the book, you didn't. You couldn't read what I read. You couldn't get to the articles I had.
Right.
They were buried in a medical library.
Right, off in the middle of nowhere.
It used to take me like hours to get to 4 articles, and you weren't even allowed in the library. The internet has changed everything.
Yeah, it's like everything is accessible, which can be, good and bad. I tell my patients all the time, like, don't use Google as your doctor. There's a lot of information that is not true.
I think on balance, it is fantastic. And I think you're right about the not relying upon it. But you show me a patient, an intelligent patient with a diagnosis and some curiosity.
Right.
They're going to know more about their disease state than most of the doctors.
Yeah, because they've been researching it and being curious. And that's the best part about having the internet. And, patients come to me all the time with information and ask me to research it more, like, okay, I found this out. What do you think about it? Have you heard about any studies that support it? So then I could get on my path and find out more, because there's so much research out there. And there's also research that hasn't been done. So then we have to make our best judgment based on the research it has.
That's a great service. As a naturopathic doc, that's your background. Is that correct?
Yes.
So it gives you a unique perspective. And I am fully endorsing of expanding health access beyond conventional medicine. Your family doctor, God bless him or her, simply doesn't have the time.
Right. No, 15 to 20 minutes is not enough time.
They don't have the time not only to engage the conversation, but they don't have the means to document it.
Right.
If you go to a conventional doctor and he talks to you about chelation therapy, it's not standard of care.
Right. It can't be reimbursed.
You're lighting up a lot of red lights there in the clinic.
Right. Yeah.
You and I have an ability to at least converse in a more tempered manner. I believe that there needs to be more educated healthcare leaders like you more people stepping into that space so that the Google patient can have an authoritative source that's not going to be dogmatic.
Right.
You and I aren't here saying, oh, throw away all your
Do this.
medicine.
Right. Yeah.
Just eat sprouts and you'll be fine. Or what is it? Pecan pits and your cancer will disappear.
Right. No, there's a balance. There's a balance. Yeah.
It is a continuum. You're absolutely right. And the continuum is this, folks. Health is your prerogative, your responsibility, your choice. Invest in it as you will, do your research, and then make it fit your life. And the sooner you start, the better it's going to be, the less disease risk you're going to have. So my wife asked me an interesting question, I thought. She said, if you were dying, would you regret anything? And I thought, of course, she was referring to like my health practice, not my life.
Right. Yeah.
I had to think, I do hormone therapy, hormone replacement. I do infusions. I do about 2 a month. I take an array of supplements. I do what I consider to be health extending exercise. I'm not like conditioned for triathlons. And I concluded that I'm at peace here, so that if diagnosis of cancer comes, if heart disease comes, I'm not going to be thinking, damn it, I wished I'd fill in the blank.
Climb Mount Everest. Not on the bucket list. Yeah. That's great. Yeah, I love that. Having that vision of where are you? And I think that's really important actually for people to think about in this preventative state that we're talking about, that new state of medicine, which unfortunately is not really new, but people are calling it new, and preventative medicine. And looking at your life, I talk about with that patients all the time, having the vision. What do you want to be doing? And it's totally accessible. Do you, like you mentioned before, do you want to spend more time with your children and grandchildren? Let's make it happen. It's like they've been given this stamp, like, this is it. This is your stamp for you can't do this anymore. But that's not really true. We can make the change. We just have to open the toolbox, and try different tools and be able to see the cellular map and say, hey, there's some toxicity going on. Let's get it moving out of the system.
Yeah, no, we call our center intellectual medicine. It's IM 120. The 120 stands for the pursuit of the 120-year lifespan. There is absolutely a phenomenon of self-fulfilling prophecies. If we presume our lifespan is going to end at 80 or 90, we're going to act accordingly.
Right, exactly. Yeah.
David Sinclair is a PhD researcher out of Harvard. He wrote a book, Why We Age and Why We Don't Have to. There are scientists contributing to the cellular basis of aging and the disease processes, and they are feeding clinicians like you and I validated information. I see our job is taking the bench research and delivering it like right now.
Right.
Because we can't wait look, the FDA and medicine does not exist to keep you healthy. It exists to intervene in disease states, to mitigate and correct the disease occurring. Health is something that we all have to pursue, like you're talking about, and it is a cellular pursuit, and chelation is a component of that whole.
Yeah, that's great. Okay, I think we could talk for hours, but I know we need to wrap things up today. So just like I have 2 more questions. We'll be quick. One, what do you think is the impact of the DNA? Because we didn't really go into that part of the cell. So what are the toxins doing on the actual cellular function of the DNA?
Yeah, it's an epigenetic phenomenon. The DNA absolutely is a contributor, but it is not the determinant. It's not your fate, it's your predisposition. We know that the expression of DNA, a process we call methylation, can vary depending on the environment the DNA is exposed to. So if you have DNA that is predetermined or predisposed towards dementia, well, that predisposition typically will not manifest itself unless the right ingredients are introduced to that DNA.
Right, it's like a soup formula.
Yeah, so you know what, the take-home message is, don't take false comfort because your grandparents lived to be 100. You can learn good DNA.
Yeah.
Conversely, don't feel forlorn if everybody in your family died at 50.
Right, we can make a change.
Make that change. You can absolutely communicate change to the DNA. So the DNA is dynamic in the way it expresses cellular health.
I love that. Yeah, and I just had a 50th birthday, like last month, and people always like, what? You don't look like, they think I'm 20. And I'm like, well, I take really good care of myself. And that's the whole like thing we've been talking about today is that preventative, health. Like I vision myself, I feel 20. I feel like inside and outside. I mean, of course I look a little bit different than I did when I'm 20, but not really, and so I love that, we can make the change with our DNA. It's just about being able to see it with a different lens. And I think that's what you're doing is really making that impact. So kudos to that.
Likewise, and kudos to you as well. And the Genome Project has been fascinating, but
Yeah.
there's something very comforting about being fatalistic.
Right.
If I simply say, well, my genes determine my outcome, it means I don't have to do anything.
Right. Yeah. No.
The
Let's
bad news
not
for
have that
those of
stamp.
you, bad news for those fatalists is no, you actually can have a huge impact.
Yeah. And I think that's the eye-opening thing that people are seeing. Okay, one last question. If you had an unlimited budget right now, what would you do to make the biggest impact on the planet?
Me, based upon what I can deliver,
Mm-hmm.
I would open up drip bars within 30-minute radius of every person in the developed world. And I would create a foundation to make infusion available to people of limited means. When we talked about lead in the umbilical cord, I can only begin to think about communities of poverty with generational poverty, with generational contaminated water supplies. And can you imagine like maternal inheritance of this toxin and the potential damage it can have to brains over generations? So while I don't have those funds currently, we are committed to it. My wife, Shannon, along with her partner, Ben Crosby, have taken the drip bar concept and have developed it as a franchise and incorporated it. And they opened up their third center in Colorado. They're opening one in San Antonio, and they're well on their way to making that vision happen and giving people information and access. So with those two things, we're going to fill that space between.
I love it. And that's a great vision, and it can totally make that happen. And I think we're seeing it a little bit more awareness, people listening to this podcast today and just really learning about how important and valuable for the health, and not only chelation therapy, but is infusion therapy as well.
Absolutely. And, another time we'll talk about that vis-a-vis cancer, which it has a huge potential impact in that arena. But hey, this has been a lovely opportunity. I'm just really delighted talking with you, and happy birthday, 50. My God, you look fabulous.
Thank you so much. Thank you, Dr. Stephen. It's been such a great joy to have you on the show today. And I look forward to having you back again, but let's talk about some ways people can find you. So your website.
Right. It's if they go to intellectual medicine or Dr. Petteruti, if they Google those terms, will pop up. Drip Bar can also be searched. And although it's a separate company and I'm not directly involved with drip bars, I do provide the science and research and sort of the formula information for that. So those would be two primary ways. And if they go to Dr. Petteruti podcast, I do a periodic podcast discussing topics of anti-aging and life extension.
Great. Awesome. Yeah. Your website is a plethora of wonderful information, from your book, The Cancer Machine, to your fascinating blog, and also your podcast, which is great. So thank you for all the work that you're doing. And thanks again for joining us today.
Likewise, Lily. It'd be fun talking to you again. Appreciate the opportunity.
Great. Thank you so much.